sitting at the dining table next to those who you love, when suddenly the person sitting across from you clutches their chest and collapses to the floor. Would you recognize what is happening? Would you know how to respond? And most importantly, would you feel prepared? If your answer to any one of these questions is no, then I strongly urge you to continue listening, because what you can learn can save your life or the life of someone you love. According to the American Heart Association, heart disease is the #1 cause of death worldwide, and every 40 seconds, someone experiences a heart attack. Because of this, heart attack education is absolutely essential. So today, I will be discussing what exactly a heart attack is, how to recognize the signs and symptoms, and ways that you can prevent the risk. So before we discuss what exactly a heart attack is, it's very important to understand the basic function of the heart. Your heart is a powerful pump that sends blood to and from the rest of your body. Your body consists of deoxygenated blood, which is blood without oxygen, and oxygenated blood, which is blood that is rich in oxygen. Deoxygenated blood enters the heart through the inferior and superior vena cava. It then goes to the right atrium, through the tricuspid valve, and enters the right ventricle. From here, it's sent through the pulmonary artery to your lungs to become rich in oxygen. After that, it goes through the pulmonary veins back to the heart, into the left atrium. It goes through the bicuspid or mitral valve, into the left ventricle, and from there it gets sent through the aorta to the rest of your body. Now that we understand the basic function of the heart, we can now answer the question, what is a heart attack? Simply put, a heart attack occurs whenever that blood flow to the heart is restricted. More specifically, when oxygenated blood can't get to the heart. According to the Mayo Clinic, this blockage usually occurs as a result of fat buildup or cholesterol buildup in the arteries. Without oxygen, the muscles of the heart will quickly die, leading to permanent damage or death if left untreated. So now that we understand what a heart attack is, we can now discuss the signs and symptoms. According to the Mayo Clinic, common symptoms include chest pain, pain that radiates throughout the body, shortness of breath, nausea, and sweating. It's also important to understand that these signs and symptoms can vary from person to person. For example, women tend to experience more back pain and fatigue as opposed to the more common signs and symptoms. If you suspect that someone or you is experiencing a heart attack, please do not wait. Call 911 and seek medical attention immediately. Acting quickly can save your life or the life of someone else. Now that we know that recognizing these signs is absolutely crucial, we can discuss prevention, which is even better. According to the American Heart Association, regular exercise, a balanced diet, and avoiding smoking are key ways to keep your heart happy and healthy. Regular checkups can also detect things like high blood pressure, cholesterol, or diabetes, which can all contribute to a heart attack as well. Now let's take a moment to review everything that we learned. We discussed the basic function of the heart, and we now understand that the heart is responsible for sending oxygenated blood to the rest of the body. We learned that the blockage or prevention of this blood flow is what causes heart attacks, and that the signs and symptoms can vary from person to person. Finally, we learned that eating a healthy diet, regular exercise, and routine checkups are all key ways to keep your heart happy and healthy. So the next time that you're at the dining table with someone that you love and they clutch their chest and collapse to the floor, you'll now recognize what's happening and know how to respond. Thank you.